Good afternoon and welcome to Wednesday Wellness. Today I'm going to start off by answering some of the questions that you've submitted that you want to discuss today. And we're going to end our session today with one of the new things that we want going on for prevention, and that is exercise. Mr. John Lewis, if you've been to any of our forums before, has given a demonstration of how you can build in some exercise even if you're not particularly mobile. So in a couple of minutes, we're going to let you see Mr. Lewis, and I want you to exercise along with him. So let me get to some of the topics that you are interested in. I still get lots of questions about how do you diagnose Alzheimer's and how do you give that information to family members who may be in denial about what their diagnoses are. And there were lots of questions about how to help families. So let me get to the first one about diagnosis. How do you get a diagnosis? The first place that anybody should go for a diagnosis of a dementing disorder or to find out what's going on with a person who may have a dementing disorder is your primary care doctor. Now, why do I say go to your primary care doctor? Because a lot of things can happen to a person and it looks like it's dementia, but it may not be. So dementia is regarded as an irreversible or can't be reversed change in the way your brain functions. And that's what we call a neurocognitive disorder. But there are some medical disorders that cause your brain to kind of short circuit and not work properly. And chief among these chronic diseases or medical diseases that cause a problem with how your brain works are those diseases that are associated with cardiovascular disease, i.e. your high blood pressure, your cholesterol, controlling your diabetes, and if you have a cardiac problem or a heart problem, making sure that you manage those things in the best way that you can. The second most commonly diagnosed dementing disorder is a mixed dementia that may be a combination of both Alzheimer's disease and vascular disease. So let's talk about some of the other medical disorders that can create brain dysfunction. I've mentioned some of the cardiovascular disease, but other things create problems. Acute or active medical illnesses, such as dehydration, being actively infected with a pneumonia or a urinary tract infection. And once you have these things, if you are sick, if you are dehydrated because you're not drinking or you're not getting enough food or whatever, if you are delirious, that's a medical emergency and that needs to be addressed. And usually when you correct that medical emergency or that medical problem, the person's cognition reverts back to normal. So going to a neurologist if you are actively ill or your person has an uncontrolled medical disease, it's not going to be of much benefit because the neurologist can't figure out what's medical and what might be neurologic. So we want you to start with your primary care doctor. So what are the kinds of things that your primary care doctor should do if you're over the age of 65? We are promoting active engagement in the annual wellness visit. Why? Because the annual wellness visit allows your primary care doctor to establish a baseline for what your physical function is and for what your cognitive functions are. There are a lot of elements that are involved in the annual wellness visit. It is not a physical exam where you take off your clothes and the doctor examines you. Rather, it's a checkoff about what kinds of preventive health measures you need to pay attention to and what you need to have scheduled to make sure that you're in the best health that you can be. So during the annual wellness visit, which is a once-a-year visit, your doctor may do a memory screen. So let's say we've gotten past our annual wellness visit and we've had our annual memory screen, but you've noticed that there's a change in an individual. Well, you go back to that primary care doctor and say that there's been a change in my relative's behavior since you saw him last. And the doctor may opt to do another screening exam, but more importantly, they're going to look for some of the other things that may be causing a sudden change. And people who have sudden changes in their cognitive status usually have a medical reason for doing that. That's why we want you to start with your primary care doctor. So, aside from managing your high blood pressure, your diabetes, making sure that you're taking the medicines that you're supposed to be taking in the proper manner, because we have a lot of adverse or drug-drug interactions, and some medications don't react well together. So a lot of people have medications that they take that have been prescribed, and they mix them along with some holistic combination, or they mix them with alcohol, and those are things that have a tendency to make your brain dysfunction. So you have to kind of look at all those things, and that's kind of the job of the primary care doctor. One of the questions was, what do you do with a person who's dealing with denial and doesn't believe that there's a problem? Well, that's when you seek out the services of your healthcare professional. Your primary care doctor can probably refer you to somebody else who can better assist with that. Again, that is not a time for you to ask your friends or your neighbors what you should do. This is a time when you should consult your primary care doctor, because whether you think they know anything, they're generally the people who can pick up the telephone and get you where you need to be as quickly as you need to get there. So I want you to make sure that your overall physical health is good, that you've managed properly your high blood pressure, your diabetes, anything that can go awry. If you're taking heart medicines, making sure that you're taking them as you're supposed to, and also making sure that your heart disease is well controlled, because one of the risk factors or one of the long-term sequelae of poorly controlled cardiovascular disease, particularly in African Americans, is the development of strokes. Now, all strokes don't result in physical incapacitation. A lot of strokes manifest themselves in cognitive abnormalities. Now, if you have cognitive abnormalities or brain dysfunction or memory loss related to a stroke or mini strokes that you've never been given a diagnosis for, is that going to be helped by some of the medicines that we use? Probably not, because most of those medications weren't intended. The Alzheimer's medications, and there are 4 that we use, were not intended to manage vascular dementia. As research progresses, we're going to work on some things that may help treat these diseases better. One of the questions that you asked is like, okay, what about these medicines? Well, as I talked about last week, we had 4 main medications that are used to treat people with Alzheimer's type dementia. Unfortunately, these same 4 drugs are also used for any type of dementia, because a lot of people don't have a full understanding of what their dementia is, and their doctors don't have all the tools that they need to make sure that they have a clear diagnosis. So they're going to prescribe the donepezils and the Exelon patches. And until it's proven that you don't need these things and these medications aren't benefiting you, most doctors are going to put you on them. So one of the questions is, what are we doing for therapies? Well, there are a number of different therapies that are in the pipeline. They're medical therapies. Most of the medical therapies that are under investigation at present are being developed for people who have moderate stage disease, or early forms of the disease. So how do you know if you have the early form of the disease? And if everybody in your family on a side died at a certain age and had dementia, how do you know you're at risk? You know, what kind of test is there? Well, there's no test really that your primary care doctor or a neurologist in practice is going to do. Most of the surveillance is done in research. Here at Emory, we have a familial study where we're studying people who have a history of early onset Alzheimer's dementia, that is before the age of 50. And those people have genetics that kind of predispose them towards this disease. So one of the things we do in research is we look at your genetic profile, we look at your chromosomes, and we look at your brain. And that's really, quite frankly, the only way that you can figure out whether somebody's at risk or whether somebody's not at risk. Now, you can go to a geneticist and ask for a genetics test to look for the ApoE4 gene, but there are almost 25 to 30 other genes that we've identified that are present in persons with Alzheimer's disease. ApoE4 gene has been better studied, but there are others. So I don't care how much money you have, it doesn't matter. You can't generally go to a genetics office or a primary care doctor's office and get a test to understand what your risk factors are. So what can you do? The most important thing you can do is take good care of your body such that you prevent any kind of process that may contribute to the development of dementia. in African American persons, there's a gene called the ABCA7, which turns on what we call the Alzheimer's cascade in the presence of poorly controlled high blood pressure and cardiovascular disease. So it's like, well, how do I know if I have it? Well, I don't know whether you have it, and your doctor won't know either. That's a research type study, but we do know that that particular gene doesn't exert its influence in terms of developing or predisposing somebody toward Alzheimer's unless the person has poorly controlled high blood pressure, diabetes, or other cardiovascular risk factors. Research has focused on what can we do about that. You know, we talk a lot about vascular dementia. It's extremely more prevalent in persons of color, African Americans and Latin Americans versus European Americans, simply because we have a higher incidence of cardiovascular disease. Well, we followed a population of people in Massachusetts for about 40 years. There's a study called the Framingham study, which was started to look at people who were basically healthy, living their lives, and to try to understand what they could do to reduce heart disease. So they started teaching people about heart disease and protecting their heart and doing lifestyle changes, dietary changes, and working with medications that help prevent heart disease. And 40 years since we started that study, we've learned that the incidence of dementia in that population has decreased. As the incidence of heart disease has gone down, so also has the incidence of dementia. So more research is focused now on prevention risk factors, not so much treatment or drug development that is ongoing, but there's greater value in preventing chronic disease and controlling chronic disease. We have a study called the Pre-DIVA Prevention of Dementia by Intense Cardiovascular Care. And that was a study done in Europe where nurses followed people who have had advanced cardiovascular disease and other chronic diseases, chief among the ones that I've mentioned before. And by managing those diseases, they managed to keep people who had memory impairment or dementia out of hospitals and keep them in better health. And the idea was that if you control their chronic diseases, you decrease their risk for dementia. So the pearl for you is, if I have any of these chronic diseases, I need to make sure that I do my very best to take care of myself. So that's taking my drugs as prescribed, that's working on weight loss, but more importantly, that's staying physically active and physically engaged. On that note, aside from being physically active and physically engaged, you have to stay intellectually engaged. Socialization, processing exams like computer games, word games, anything that causes your brain to work a little bit faster than if you were just sitting down watching television. We don't want you watching television. We want you up physically engaged and socially engaged. Those are preventive strategies for preserving your cognitive function. Now, one of the questions that somebody had was, I need help. My mother is a caregiver for my father, and she really needs to go to a caregiver support group. Where can I find one? So we are directing all of our families to entities that are likely to give you the services that you need or help direct you to those services. One of those organizations that's key for us is the Alzheimer's Association. They can be reached at 1-800-272-3900, 1-800-272-3900. Now, why are we sending you to the Alzheimer's Association? Because they provide case management services for free. If you have a problem identifying a provider, whether it's a primary care provider, a neurology provider, an adult daycare program, or assistance with finding a caregiving support group or training to help you manage your job of caregiving, they can help you with that. A person answers the phone and provides that resource to you free of charge. For those persons who may be wandering, it's important to make sure that your relative has a safe return ID bracelet, and the Alzheimer's Association can also help you with that. There's nothing that substitutes for your own education. So we've got lots of websites that you can look up Alzheimer's disease, and a whole bunch of things will come up. But my favorite websites for you are going to be the Alzheimer's Association website, the Us Against Alzheimer's website, for information, and the National Institutes of Aging. There are lots of commercial things that you can look at, but I don't want you looking at a commercial site that's trying to sell you a product, because there is no medication, no product currently available that cures Alzheimer's disease. I don't care what they tell you, there's nothing available. There is no medical treatment at present that cures Alzheimer's disease. So, in the interest of self-motivation and self-preservation, I need you to exercise. And one of the persons we have here with us today is Mr. John Lewis, and he's going to give you an exercise demonstration, if you will, about things that you can do in your own space. Does it take a lot to exercise? Why does everybody tell me to exercise? Because exercise improves blood flow. Improving blood flow decreases your blood pressure, increases the amount of blood that gets to your brain to keep your brain healthy, and that's why you need to do it. So I'm going to let Mr. Lewis come here right now. He's going to provide a demonstration for us. And Mr. Lewis, I'm going to move out of this space, and I'm going to have Mr. Lewis tell you a little bit about what he does. But if you come to our forums, he's going to tell you a little bit, demonstrate for you. He's going to demonstrate for you in a few minutes exactly what he does. Mr. Lewis? Tell them what you want them to know.
Good. My name is John Lewis, and I'm from Energy Fitness. And I'm an activist for you starting an active lifestyle. And with creating a lifestyle, cardiovascular disease, the first word is cardio. You have to make sure that you be active. Find a way to be active. I have developed a new exercise to a lot of people, from seniors all the way down to youth. And also, if you can't dance or you just feel like you can't move, your balance is off, this chair size will take you to the next level. Even if you want a body sculpt, get everything back tuned up, hey, this chair size is for you. But also, with creating a lifestyle, where do you start? A lot of people out there today don't even know where to start. So, with that, we're going to be showing you different ways to start, different ways to continue, and also different ways you can take it to the next level. But before you even start anything, you must go to your physicians and make sure your heart is running right, your knees are okay, making sure all your vitals are up to par. So, wherever you need to go at Emory, and you take it to the next level, to the next level, to the next level. It always continues to go to next levels. I'm always pushing myself to take things to the next level. You'll hear me say that a lot, taking it to the next level, because that's what life is all about. Taking it to the next level. So with that, in a few minutes, we're going to show you some exercises, not only for cardio, but also for those abs. I'm going to show you exercises for your arms and also for the mind. And with that, I'm John Lewis from Energy Fitness, and I'll see you soon.